Printed Tryon. The printed Tryon is a prototype for a final restoration. It is digitally designed, printed in resin, and then temporary cylinders are cemented inside to fit on the multi-unit abutments. The printed Tryon can be created a few different ways. One is for the doctor to perform the iJig scan, and we have videos and information on this on the website, but simply scan the prosthetic outside the mouth with our proprietary iJig scan bodies, scan the opposing, scan the bite, and then when that's finished or before, scan the arch only, the tissue in the multi-unit abutments. With all those scans, we will create the iJig. The iJig is a sectioned reproduction of the scan. It's sectioned, it's printed, it is then luted together in the mouth, and a reline is performed. In this case, it's a double arch. And from this record, we have everything we need: implant position, tooth position, bite registration, and the new tissue level after healing from surgery. From this, we will make a printed Tryon, and this will be delivered. It will be tested for passivity with a one-screw test. It will be equilibrated, and then if any adjustments need to be made for aesthetics, for contour, for patient total acceptance, they should be completed at that appointment and not sent back with just simply a bite with some instructions. Equilibrate, try to make the prosthetic so that it is a true prototype of the final, and perform a reline impression if needed, and send the physical case back to Rowe Dental Laboratory. In this particular case, the doctor wanted more changes, and so we performed another digital setup and sent this back for Tryon, and now we're ready to go to finals. This second printed Tryon always comes with a charge. It's a fee. So that's important to know as far as patient pricing. And another reason to ensure that the printed Tryon at the first step was handled with care and diligence, with equilibration, and making it a true prototype. So this is one technique. This is the iJig technique. There's also the rapid appliance technique. This prosthetic was picked up at surgery. So chrome was performed. The doctor picked up and converted the surgical prosthetic, but then also converted the second prosthetic that's included in the case, called the rapid appliance. So you can see the cylinders were picked up here at surgery. The case was equilibrated. There was a reline impression 6 months down the road. This was sent in, and then we make a printed Tryon. It's very important to remember that the printed Tryon must fit passively. You can perform a one-screw test. Be sure to capture an x-ray of every site, and if for any reason it's not passive or it's not down, section between the implant, seat it so that you know that there's a gap and it's passive, and then relute together. And we could go right to a final from this, or if you'd like to do another Tryon, of course there's a charge from the Tryon, perform it, and then we know that we are dead on. The printed Tryon.